This is how your knee should look. And this is how your knees probably look if you have arthritis. You probably find waking, climbing stairs, or even sitting comfortably difficult. So maybe you're here because you're tired of the constant pain and discomfort, and now you're looking to find relief without having to rely on medications. These are the common problems faced by my patients with knee arthritis. So in this video, I'm going to share some of the best ways to ease arthritic knee discomfort and improve your mobility so you can reduce or even eliminate the need for medication and hopefully avoid surgery later on down the line. But first, let's dive into what arthritis really is and how it affects your knees. Arthritis literally means a joint inflammation. The term arth refers to joints and itis means inflammation. There are many types of arthritis, but today we're focusing on osteoarthritis. Osteoarthritis is a degenerative joint disease characterized by the breakdown of cartilage, which is the protective tissue at the ends of bones in the joints. This breakdown leads to pain, swelling, stiffness, and reduced joint mobility. Over time, the condition can cause bones to rub against each other, leading to further damage and discomfort. Osteoarthritis commonly affects weight-bearing joints, such as the knees, hips, and spine, and is often associated with aging, joint injury, or repetitive stress on the joints. Let's take a closer look at the knee joint and what happens when arthritis develops. Here we have a model of the right knee. This is the femur or the thigh bone. This is the tibia or the main bone in your lower leg. And this is the fibula, the smaller bone on the outside of your leg. Here is where the patella or the kneecap would sit. Inside the knee, we have the meniscus, a C-shaped pad of cartilage that acts as a shock absorber. Each knee has two menisci, the medial meniscus and the lateral meniscus. The cartilage caps the bones on either end, providing a smooth, frictionless surface allowing for movement. But if you have arthritis, your knee doesn't look like this. The cartilage in an arthritic joint wears away, exposing the bone underneath. It starts with minimal erosion, such as what you can see just in here, and over time, it progresses to more and more bone exposure. So this would be the next step. As it leads to more and more progression of erosion, we end up getting more stiffness, pain, and a grinding sensation of the joint. Over time, so this is a severely arthritic knee, and over time, we can get bone spurs or osteophytes, which can also form around the joint. So instead of the joint looking like this, it starts to look more and more like this. So how does arthritis happen? Well, traditionally, osteoarthritis was thought of as a wear and tear disease. However, new research suggests multiple factors are involved, including previous injuries, genetics, age, obesity, and environmental factors like nutrition. Many people believe that running causes knee arthritis, but there's little evidence to support this for the average runner. In fact, weight-bearing exercise might help to maintain healthy cartilage by promoting the production of beneficial proteins and reducing inflammation. It seems to be a use it or lose it situation whereby using the joint helps to strengthen them, much like how a cricketer strengthens a new bat by hitting it repeatedly to knock it in. So what happens when you are first diagnosed with arthritis by your doctor? Well, almost all medical professionals will always recommend that you try to maintain your knee health and do as much self-maintenance as possible. For any patient with arthritic knees, the first course of action will be to encourage regular stretching and strengthening of the knees and the surrounding muscles. The goal is to maintain function for as long as possible and slow down the rate of deterioration. What about if you are experiencing pain or constant discomfort? For those who are in more discomfort or pain, you may be prescribed pain medication such as paracetamol or opioid-based medications such as codeine. Anti-inflammatories such as ibuprofen and naproxen are often also used, and this includes topical creams such as Voltarol here in the UK. In some instances, corticosteroid injections may be given to reduce pain and inflammation. Now, while medication is appealing for many patients, there are side effects and risks associated with their use, especially long-term use. Many pain medications can have addictive effects as well as digestive side effects. Some of my patients can't take any anti-inflammatory medications due to digestive issues. The use of NSAIDs, or non-steroidal anti-inflammatory drugs such as ibuprofen, have in some studies been shown to have a detrimental effect to the cartilage health. This is not conclusive, as some studies also found no change, but it is certainly worth being mindful of. So medication should always be taken with caution, especially when taken on a long-term basis. What if there was a way to reduce inflammation and pain without the use of medication? Well, there is. In fact, there are multiple methods. One you are probably familiar with is cold therapy, or ice packs. This works by causing constriction of the blood vessels and thus restricting the blood flow to the area, therefore reducing inflammation and pain. The advantage of using cold therapy is that it's practically free and easy to do. I recommend no more than 15 minutes of cold application at any one time. However, there is another method I've been using recently that seems to be even more effective than cold therapy, both according to my own findings and according to what's published in the scientific literature. Now, I have to be honest here, when I first heard about this method, I thought it was a gimmick and a fad, a trend, or whatever you want to call it. I couldn't make sense of how it could help. But the more I started seeing people talking about it, the more I thought it was worth looking into. And so I did. I have now read so many scientific journals, reviews, meta-analyses in PubMed, and overall, the research is incredibly supportive of this method for multiple uses and health benefits. I gave it a try on myself and my patients, and since then I have used it almost every day. I'm talking about red light therapy, and I will show you in a second how I've been using it clinically and how you can benefit from it too. So what is red light therapy? Well, red light therapy, also known as photobiomodulation, is a treatment that uses specific wavelengths of light to improve skin health, reduce pain, and promote healing. This therapy involves exposing the body to low levels of red or near infrared light. Now, light is a form of energy that travels in waves. The distance between two peaks of these waves is called the wavelength, which is measured in nanometers. Different colors of light have different wavelengths. For example, blue light has a wavelength of about 450 to 500 nanometers, whereas red light has a wavelength of about 620 to 750 nanometers, and near infrared light has a wavelength of about 750 to 1200 nanometers. And you can't see the light at these wavelengths. So how does red light therapy work? Well, when your skin is exposed to light, the light penetrates your skin and is absorbed by cells. How far that light penetrates the skin depends on the wavelength of the light. Within the cells are molecules called chromophores that absorb red light and become energized. The energized chromophores help the mitochondria, or the powerhouse of the cell, to produce more adenosine triphosphate, or ATP, which is the energy currency of the cell. More ATP means more energy, which means that cells can function more efficiently and repair damage faster. The increased energy production boosts various processes and effects in the body, such as enhanced collagen production, it reduces inflammation, and improves circulation. Now that we know roughly how red light therapy works, what are the benefits of using it as a therapy? Well, red light therapy has been shown to provide various health benefits, including skin rejuvenation, so it reduces wrinkles, fine lines, and age spots; wound healing, that speeds up the repair of cuts, burns, and other injuries; pain relief, easing chronic pain conditions such as arthritis; muscle recovery, helping muscles heal after intense exercise; and even hair growth. So how can red light therapy benefit you if you have arthritic knees? Well, the first benefit you may notice could be a reduction in pain. Just simply having less pain in the knees will make you feel so much more able and comfortable. Red light therapy has been shown to be able to modulate pain pathways and decrease production of pain chemicals and inflammatory chemicals. With the reduction of inflammation also comes a reduction of swelling, which will not only reduce pain, but improve joint function also. Red light therapy has also been shown to enhance cellular repair processes, which can promote the health of cartilage cells or chondrocytes and potentially slow down the progression of cartilage degeneration. But despite this being able to reduce inflammation and pain and improve cellular repair, the best thing about this is that you can easily do it yourself at home, which means you get the dosage you need and is considered completely safe with no reported side effects that I know of, unlike the pain medications that I mentioned earlier. So how could you use red light therapy for your knees, and how do I use this with my patients? Well, you can pretty much use any red light therapy device with wavelengths of around 660 nanometers and 808 or 810 nanometers of red light. These wavelengths have been well studied and have been shown to have beneficial effects for people with arthritis. There are also clinics who offer laser therapy, and these professional devices will often operate using higher power than home devices. However, you will often need to attend multiple appointments, and these services are often not covered by insurance or Medicare if you are in the US. This is why so many patients are turning to home devices like this, since it is a one-time investment and they can be used daily without the need to pay per session or the need to travel to a clinic. The device I use is the Kineon Move Plus because it's small and easy to travel with, as it doesn't need to be plugged into any mains. It has both 660 and 808 nanometers of red light using LEDs and infrared lasers. It sits directly on your skin, which means there's very little dispersion of the red light away from the target area, and it's super easy to use. You can simply click the modules into the strap and clip the strap around the knee. I would strap one module either side of the patellar tendon and one module on the back of the knee. Then turn it on with one press of the button, wait for it to turn off after 15 minutes, and that's it. The dose I get my patients using is 15 minutes per knee, twice per day, and no more. The most effective dose seems to be around this 15 minutes, 2 times a day frequency. If you go more than that, then the beneficial effects seems to decrease. This dosage is simply what I recommend, and from anecdotal results from the thousands of patients using this device. There is currently no well-researched optimal dose for any red light therapy, so feel free to play around with the time and frequency, but remember, sometimes less is more. I use the Move Plus on my patients while I'm treating them. For example, I'm using it on this patient's arthritic knees while I work into her painful shoulder. If you're interested in the Move Plus, I have a discount link below that will give you a 10% discount if you decide to purchase. I am affiliated with this product, so I will make a small commission at no extra cost to you. I have been using this device on my patients in their treatments, and I use it on myself for various injuries, aches and pains on a daily basis. And I think it is amazing. Now, when it comes to managing osteoarthritis, nutrition plays a crucial role. Let's break down how a well-balanced diet can help alleviate symptoms and support joint health. First, maintaining a healthy weight is key. Excessive body weight puts more stress on the joints like the knees and hips, accelerating cartilage degradation. A balanced diet helps to reduce body fat and consequently systemic inflammation. Next, focus on anti-inflammatory foods. Omega-3 fatty acids found in fatty fish like salmon and mackerel, flax seeds and walnuts help to reduce joint inflammation and pain. Antioxidants such as vitamin C and E, selenium and carotenoids neutralize free radicals that can damage joint tissues. These are abundant in berries, citrus fruits, nuts, seeds and colorful vegetables. Polyphenols present in fruits, vegetables, tea and olive oil also reduce inflammation. Supporting cartilage health is another goal. Collagen, a primary component of cartilage, can be boosted by consuming bone broth or collagen supplement. Vitamin C, essential for collagen synthesis, is found in citrus fruits, strawberries, bell peppers and broccoli. Adopting specific dietary patterns can be beneficial. The Mediterranean diet, rich in fruits, vegetables, whole grains, fatty fish and olive oil, is known for its anti-inflammatory effects and joint health benefit. For many people, animal protein can also be hugely beneficial, but the quality of the meat you eat is important, and eating a higher quality meat such as grass-fed or outdoor raised can have higher levels of anti-inflammatory fats compared to animals raised in poor conditions, which typically tend to be more inflammatory. Staying hydrated is essential. Proper hydration maintains joint lubrication by aiding production of synovial fluid, reducing friction between cartilage surfaces. Here are some practical tips. Rather than trying to make drastic and unsustainable changes to your diet, try gradually increasing your intake of fruits and vegetables. Aim for a variety of colors to get a wide range of nutrients. Then, where possible, try to include fatty fish in your diet at least twice a week. Use healthy fats like olive oil and nuts. Aim to increase your daily water intake, gradually increasing each week by 1 glass. Lastly, try, where possible, to limit processed foods high in refined sugars and trans fat. It's all about making small changes over time, but by incorporating these nutritional strategies, you can help manage osteoarthritis symptoms and improve your overall joint health, not to mention your overall health too. Patients always ask me about supplements, and I'm sure you want to know what the best supplements are to help alleviate symptoms and support joint health. Let's go through some of my most commonly recommended supplements. Now, this list is backed by examine.com, an independent website that looks at the available published evidence to help you make more informed decisions about your supplement choices. First is glucosamine. Glucosamine is a natural compound found in cartilage. It helps maintain cartilage structure and may reduce pain and improve joint function. Though results are mixed, many find it beneficial, especially when combined with chondroitin. Chondroitin, a component of cartilage, helps to retain water, or helps the joint to retain water. It may reduce pain and inflammation and slow cartilage breakdown. Some studies support its effectiveness, particularly in combination with glucosamine. MSM, or methyl sulfonyl methane, is an organic sulfur compound that may reduce pain and inflammation and improve joint function. Often it's used with glucosamine and chondroitin for added benefits. My advice for glucosamine, chondroitin, and MSM to my patients is to take them for around 3 months to see if they notice any benefit. If they do, then keep taking them. But if they don't, then it's up to them if they wish to continue, since the research is mixed. Omega-3 fatty acids, found in fish oil and flaxseed, have a strong anti-inflammatory properties. They can reduce joint pain and stiffness. Research supports their role in lowering inflammatory markers and improving symptoms. Turmeric, particularly its active compound curcumin, has powerful anti-inflammatory effects. It can significantly reduce inflammation and pain, with studies showing notable improvements in joint function. Boswellia serrata, or Indian frankincense, is an herbal extract known for its anti-inflammatory properties. It may help reduce pain and improve joint function, with several studies showing positive effects on mobility and pain reduction. SAMe, or S-adenosyl methionine, is a naturally occurring compound in the body with anti-inflammatory and pain-relieving properties. It may support cartilage health, with studies indicating its effectiveness in reducing pain and improving function, comparable to NSAIDs. Vitamin D is essential for bone health. It supports bone density and immune function. Deficiency in vitamin D is linked to increased pain and OA progression, osteoarthritis progression. So supplementation can be beneficial if levels are low. Collagen, a primary protein in cartilage, may support cartilage repair and reduce joint pain. Some studies show improvement in joint symptoms and function with collagen supplementation. Creatine is a compound that helps supply energy to cells, especially muscle cells. It may improve muscle strength and function, supporting joints and reducing pain. Some studies suggest creatine can enhance physical function and muscle strength in people with OA. Magnesium is an essential mineral involved in numerous bodily functions, including muscle and nerve function. It may help reduce muscle cramps and improve muscle function, supporting joint health. Adequate magnesium levels are important for muscle health and may help alleviate some OA symptoms by reducing muscle tension and improving mobility. My preferred form of magnesium is magnesium glycinate, as this form is very well absorbed. You can also try Epsom salt baths, which help the magnesium soak into your knees and thighs. Here are some tips for supplement use. Always consult with a healthcare provider before starting any new supplement, especially if you are taking other medications. Choose high quality supplements from reputable sources and follow recommended dosages. Consistency is key, as supplements often require regular use over several weeks or months in order for you to notice any benefits. Lastly, consider a combination approach, as some supplements may work better together, such as glucosamine and chondroitin. By incorporating these supplements, you can help manage osteoarthritis symptoms and support overall health of your joints. But as you can see, the management of osteoarthritis is multifactorial, and the more you can be doing to help your body, the greater the outcome is likely to be. So you ideally need to incorporate exercise, good nutrition, supplementation, and ideally some red light therapy into your daily routine consistently. Now, since I mentioned how important it is to maintain your flexibility, I think this video would be really beneficial for you to watch next. It's a simple lower body flexibility routine that you can try and it only takes around 6 minutes. So go and watch that video now.